Good afternoon, everyone, and thank you for joining today, and thank you for the invite. I'm sure you're all enjoying the meeting, which is full of excellent presentations and presenters. And thank you for the organizers, Dr. Nasreen and her team. I hope it's going to be a very successful event. My name is Noha ElSakka, and I'm a consultant medical microbiology in Aberdeen, UK. I'm also the director of laboratory medicine in Aberdeen, and I am lead infection prevention and control doctor. I'm a senior clinical lecturer at the Medical School in the University of Aberdeen, and as well, I'm the vice president of the Royal College of Pathologists. Today, I'm going to speak to you about the social burden of antimicrobial resistance, and I promise this is going to be a short presentation, a bit of an outline of what I'm going to talk about. So there is an overview about antimicrobial resistance, which I will refer to as AMR as the common acronym. We'll talk about AMR and its impact on health, food security, economy, and what is the present situation in relation to bacteria, virus, and fungi. Antimicrobial stewardship programs, One Health program, what are the next steps, and some take-home messages. So what are antimicrobials? Antimicrobials include antibiotics, antifungals, antivirals, and antiparasitics. Century ago, since their discovery, they have significantly extended average life expectancy, as we all know, and every day these essential medicines save millions of lives. AMR occurs when bacteria, viruses, or fungi and parasites no longer respond to antimicrobials. As a result of this drug resistance, antibiotics and other antimicrobials become ineffective and infection becomes difficult or impossible to treat, increasing the risk of disease spread, severe illness, disabilities, and death. AMR is known now as the slow pandemic. Livelihood, and health inequities have been exacerbated by COVID-19. The world is facing now this slower pandemic of AMR. New data confirms that AMR is now the third leading underlying cause of death globally, with disproportionate impacts on the most vulnerable demographics. So what with AMR and health? It is one of the top global public health and development threats. It is directly responsible for 1.3 million deaths and contributes to 5 million deaths every year. But this is just the start. This map shows you the impact of AMR globally. This was from 2019, with an estimated of 1.2 million people died on that year from antimicrobial resistant bacterial infection. Behind every number, there is a real human cost. There is limited treatment options, extended hospital stays, constant medications, prolonged loss of income, medical debts, poverty, family loss, grief, you name it. The burden keeps adding up, and lives are seriously impacted, in some cases fatally. It can happen to anyone, anywhere. Even if you're in good health, a minor injury, routine surgery, or a common lung infection could unexpectedly escalate into a life-threatening situation. On top of that, those who have pre-existing conditions like cancer, HIV infection, diabetes, or untreatable infection could emerge as a dangerous second threat, striking when least expected. AMR puts a strain on health system by diminishing the effectiveness of treatment, leading to prolonged illnesses and increased healthcare costs. Loss of drug effectiveness because of AMR is increasing in both developing and developed countries. It's a global matter. If this trend continues unchecked, the world will confront a reality where many infectious diseases have no cure and no vaccination. What about AMR and food security? As AMR is a global challenge for public health and food security, it poses a threat to global health, food security, and achieving the sustainable development goals. It poses a threat to food security as it can spread through the food chain, impacting both animal and human health and causing economic losses in the agriculture sector. Similar to COVID-19, drug-resistant infections know no borders, as no single country or individual can fight AMR alone. This map shows you the flights all over the world, and that's a very big part of the impact of AMR. It comes from anywhere in the world. With increasing travel between countries, diminishing borders, the more spread is going to be. So in relation to economy, in addition to death and disability, AMR has a significant economic cost. It threatens our economic future, and the World Bank estimates that AMR could result in, I'm going to try to pronounce this number correctly, so $1 trillion additional healthcare cost by 2050, and up to $3.4 trillion gross domestic products, GDP, losses per year by 2030, and 28 million people pushed to poverty by 2050. And this is by the effect of AMR alone. The world faces an antibiotic pipeline and access crisis. There is inadequate research and development pipeline in the face of rising levels of resistance. There is an urgent need for additional measures to ensure equitable access to new and existing vaccines, diagnostics, and medicines. So what is the present situation? In relation to bacteria, the global rise in AMR poses a significant threat, diminishing the efficacy of common antibiotics against widespread bacterial infections. The current global surveillance shows alarming resistance rates among prevalent bacterial pathogens. So median reported rates in 76 countries of 42% of third-generation cephalosporins resistant E. coli and 35% for MRSA are a major concern. For urinary tract infection caused by E. coli, 1 in 5 cases exhibited reduced susceptibility to standard antibiotics like ampicillin, cotrimoxazole, fluoroquinolones in 2020. Klebsiella pneumoniae is another story, also showed elevated resistant levels against critical antibiotics. Increased AMR lead to increased utilization of last resort drugs like carbapenems. As the effectiveness of these last resort drugs is compromised, the risks increase of infection that cannot be treated. There is an anticipated twofold surge in resistance to last resort antibiotics by 2035 compared to 2005 levels, which is quite dangerous, underscoring the urgent need for robust antimicrobial stewardship practices and enhanced surveillance coverage worldwide. In fungi, as drug-resistant fungal infection increases, the WHO is monitoring their magnitude and public health impact. Fungal infections can be difficult to treat in general, including due to drug-to-drug interaction for patients with other infections, commonly HIV infections. The emergence and spread of multi-drug-resistant Candida auris and invasive fungal infection is of another particular concern. In HIV, drug resistance is caused by changes in the HIV genome that affect the ability of antiretroviral drugs to block viral replication. HIV drug resistance can lead to increased HIV infections and HIV-associated morbidities and mortalities, which otherwise would be a chronic disease. Tuberculosis is a major contributor to antimicrobial resistance. Multi-drug resistant TB, MDR-TB, is a form of TB that caused by bacteria that do not respond to isoniazid and rifampicin, the two most effective first-line TB drugs. MDR-TB is treatable and curable by using second-line drugs, but these medicines are expensive and toxic, and in some cases, more extensive drug resistance develops. MDR-TB is therefore a public health crisis and threat to health security. Only about 2 in 5 people with drug-resistant TB accessed treatment in 2022. That gives you the scale of everything. Antimicrobial stewardship is a principle that everyone should learn about. It is a systematic approach to educate and support healthcare professionals to follow evidence-based guidelines for prescribing and administrating antimicrobials. health workforce form the front line in safeguarding the effectiveness of antimicrobials. Countries need to develop and implement antimicrobial stewardship programs as one of the most cost-effective interventions to optimize the use of antimicrobials, improve patient outcomes, and reduce AMR and healthcare-associated infections. The questions we need to ask ourselves: how do we get it to be the norm that people think hard about using antimicrobials? That when they prescribe them, they are of good quality, that they pay the appropriate price for them, they steward them, and they use them for the right period of time. There is the World AMR Awareness Week, which is a global campaign to raise awareness, understanding, and best practices with the public, One Health stakeholders, and other policymakers. Since 2015, the World AMR Awareness Week is celebrated from the 18th to the 24th of November every year. And it is a very good idea to mark that week and start some initiatives, educational initiatives during that point. How about One Health and the global effort? We hear about One Health nowadays a lot. So One Health approach, as AMR is a complex problem that requires actions in the human health, food production, animal and environmental sectors, and a coordinated approach across all these sectors. One Health refers to an integrated, unifying approach that aims to achieve optimal and sustainable health outcomes for people, animal, and ecosystems. It recognizes that the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. There is the people-centered approach, where to address AMR in a pragmatic manner that puts people, their needs, and equitable access to health services at the center of the AMR response in the community, in primary care, secondary care, tertiary care, and at the national or subnational levels. It focuses on preventing infections and ensuring universal access to health services for quality diagnosis and appropriate treatment. As a crucial part of their AMR response, AMR interventions need to be integrated in national plans and strategies for health coverage and health emergency preparedness and responses. The misuse and overuse of antimicrobials in humans, animals, and plants are the main drivers in the development of drug-resistant pathogens. AMR affects countries in all regions and at all income levels. It drives the consequences are exacerbated by poverty and inequality. Low and middle income countries are most affected, and AMR puts many of the gains of modern medicine at risk. It makes infections harder to treat and makes other medical procedures and treatments, such as surgery, cesarean section, and cancer chemotherapy, much riskier. So what is the next step? Priorities to address AMR in human health include preventing all infections, which may result in inappropriate use of antimicrobials, ensuring universal access to quality diagnosis and appropriate treatment of infections, and strategic information and innovation, for example, surveillance of AMR and antimicrobial consumption or use, and research and development for novel vaccines, diagnostics, and medicine. Pharma industry has been supportive on that path, and companies set up in 2016 an AMR Industry Alliance. Davis Declaration was signed by more than 100 companies and trade associations. They called for collective action to create a sustainable and predictable market for antibiotics, vaccines, and diagnostics that enhance conservation for new and existing treatments. They set up the $1 billion AMR Action Fund with the intention of bringing 4 new antibiotics through, and that is a significant amount of money. Given the unique scientific, economic, public health, and environmental challenges presented by AMR, collaboration between stakeholders is essential to maximize the progress. So what is the take-home message from today? Key interventions across the health sectors include improving infection prevention and control in healthcare settings, improving prescribing practices through guidelines for healthcare workers, conducting public awareness campaigns, increasing human health laboratory capacity and access to diagnostics, strengthening surveillance of antimicrobial use and AMR in human population. Thank you very much for listening to me.